It's time for Plan B in terms of a new health care bill. After the last attempt failed in Congress without enough support, Republican leaders are trying again. They need to gain support from moderates and Democrats who want more aid given to those with lower incomes while still keeping conservatives on board. Students at the University of Kansas have been weighing the pros and cons themselves of what the new healthcare bill could mean for their future. 19-year-old student Allie Ryburn already feels the weight of the high cost of health insurance, especially for someone who is a full-time student with a part-time job.
I haven't got it because I have never spent the night in the hospital, never been in an ER trip.
She says she will find other ways around her lack of health coverage because even if the new bill lowers insurance rates for young, healthy people, Ryburn does not think it will be low enough for her budget.
I know it's important to have health care, and I've definitely considered what could happen to me if I didn't, but I also considered the other supports that are out there.
Ryburn hopes to get by throughout her education from student services provided at Watkins Health.
If I could just make it through these next couple of years without having something serious happen, I was that's my best shot.
19-year-old Annie Cunningham knows firsthand that the unexpected can happen at any age after developing pancreatitis last semester.
It's caused from gallstones, which is super rare for someone who's 19. We still don't know how I got it.
Her hospital bills added up quickly from each doctor she saw to every medication her body needed.
I spent 5 hours in Lawrence Memorial Hospital ICU before they had to transport me because they didn't know what to do with me, and that was $40,000.
Thankfully, her insurance covered 90% of the $300,000 hospital bill, but if some conservatives get their way, she may not be able to find an insurance plan in the future.
Just because one time I got sick in college means in 40 years I can't get the coverage I need is not comforting whatsoever.
Some Republican House members hope to repeal Obamacare further by no longer forcing insurers to cover people with pre-existing conditions.
We're all human. I wasn't supposed to get as sick as I was at age 19. No one should get that sick, but it happens.
This is Peyton Krause with J415.